In today's video, we're going to be talking about fibromyalgia. Now, fibromyalgia is a medical condition which is characterized or defined by the presence of chronic widespread pain, fatigue, cognitive symptoms, abdominal pain, cramps, and depression. Other symptoms may include insomnia and general hypersensitivity. The cause of fibromyalgia is unknown, but it's believed to involve a combination of genetic and environmental factors. But the pain appears to result from the central nervous system, and this condition is known as a central sensitization syndrome. A quick summary is that fibromyalgia is an illness which is characterized by widespread pain throughout the body. Generally, fibromyalgia affects about 2 to 4% of the population. It affects women more than men at a ratio of 9 to 1, and obesity is one of the risk factors in terms of developing fibromyalgia. The clinical manifestations, I've already mentioned, patients mention pain generally all over the body. It's more commonly felt on the neck, the back, or the chest. The pain is considered to be quite severe in intensity, and it's associated with reduced functional capacity, and when the pain is present it can last most of the day, so for a lot of patients it's quite debilitating. We've mentioned other symptoms like fatigue, sleep disturbances, cognitive dysfunction. There also may be instances of depression and anxiety. To diagnose fibromyalgia, one thing can be done which is called a tender point examination. So you take a thumbnail and put pressure on musculotendinous sites. There's 18 key sites on the body, and I'll show that in this image here. And if 11 of those sites are painful on depression, then the diagnosis is fibromyalgia. The diagnosis can also be symptom-based, so based on the symptoms that the patient's describing. However, it may be the case that patients may have other diseases instead of fibromyalgia, which could be certain inflammatory conditions like rheumatoid arthritis, inflammatory arthritis, or systemic lupus erythematosus. The symptoms could also be caused by an infection like Lyme disease or Epstein-Barr virus. So that's the differential diagnosis for fibromyalgia. I've only mentioned a couple, but there's quite a lot, and I'll put a list of them here. In terms of the pathophysiology of what happens with fibromyalgia, it's been said that there's an excess of excitatory neurotransmitters and low levels of inhibitory neurotransmitters. So that's why it's said to maybe promote more pain sensation. The treatment for fibromyalgia can be divided into non-pharmaceutical and pharmaceutical. So the non-pharmaceutical treatment would include exercise, water-based exercise to really strengthen the muscles, strength training, relaxation, massages, and yoga. The pharmacological approaches to manage fibromyalgia would include things like antidepressants. Amitriptyline is another treatment option, duloxetine, gabapentin and pregabalin are also sometimes given.